One top gut health questions for a doctor and a dietitian. So we're really excited. We'll have everyone introduce themselves. Go for it.
I'm Deli Marin. I'm an integrative registered dietitian, certified gastrointestinal nutritionist, and one of the co-founders of Married to Health.
Go for it, Lori.
I'm Dr. Lori. I'm Dr. Lori Marbus. I am a board-certified family and lifestyle medicine physician focused on nutrition, specifically plant-based nutrition, and I'm licensed in all 50 states and DC, and I see patients regularly, and yeah, so it's fun.
That's amazing.
Awesome. And my name is James Marin. I'm an integrative registered dietitian, environmental nutritionist, and co-founder of Married to Health. And we're so excited, guys. If you guys have been watching our Good Gut Lives, you know we are live. If you're watching this live, you can comment down below. We'll see your comments and we can answer your questions. So we're very excited to be here on this very special topic. Just because we get those questions a lot. We have some questions that already came in. Again, we can see your questions live. And again, it's a question of like, how do I do these things? What do I do? How do I navigate? Like if my symptoms are there, I'm not feeling well. Maybe we get so often, my doctor doesn't really know what to do. I feel lost even with my doctor, or even my dietitian just keeps putting me on a low FODMAP diet over and over again. And then my doctor just gives me antibiotics over and over again. What do I do? I'm a little stuck. So here you have really knowledgeable, experienced, integrative providers, and we want to answer your questions. So with that, I'll kind of just let you both kind of share your views on gut health. Like, how do you feel about gut health? How does that play into the rest of the health for a person and even their family and community and beyond? But who wants to, or Lori, we'll have you
start. So much to say.
Why don't you start, Delia, and I'll come
ahead,
in with my back end.
Perfect. I mean, we live and breathe gut health. So I think we're a little bit biased when it comes to this topic, although the data really is confirming kind of what we've been saying, that the gut really is the nexus of health. We have heard Hippocrates said all disease begins in the gut, but we really are starting to see so much of it is rooted in the gut, with over 70% of our immune cells rooting there in the gut-associated lymphoid tissue. We're seeing that inflammation can generate in the gut, which can spark high blood pressure, high cholesterol, high blood sugar, even cancer. So gut health, I think, deserves the spotlight that it's been given these past several years. And I think now people are really starting to realize just how much they've struggled with their gut health. I think that a lot of times we learn to downplay it because it's been a bit of a taboo topic, and we don't want people to know that maybe we're gassy or bloated or we're in pain. But I think we're starting to feel more comfortable to address it, especially with our care teams, and really just acknowledge implications that some of these seemingly benign symptoms can have on the rest of our health, our diet. I know I have so many people come to me saying, well, I want to eat whole food plant-based because I understand that that's best for my diabetes and my insulin resistance, but I can't tolerate all the plants that it would require, or, replace diabetes with any other condition. And I would say that's really where people are seeking me out. So I just feel like gut health is such an important topic, and it really starts from day one of pregnancy, which is what we're seeing. But Dr. Marbus, I'd love to hear kind of what you're hearing about gut health, what you're researching about gut health, and how, as a primary care physician, you're supporting people with their gut health.
I think I love what you said, especially about the pregnancy piece, but I even go back further. If we look at epigenetics, right? So what my grandmother consumed affected my mother's eggs, which is half of me was hanging out there during that time. And genes were turned on, right? So that can have literally multiple generation effects on what we're consuming. And I think our gut health is a reflection of just our food system in general. I think if you look at the processed foods and all the things that are considered edible things, they're not really foods, I call them frankenfoods, and just seeing what those things do to our health, not only just the gut health, but the gut is it takes the first assault, right? But then it's trying to make things right, but the body responds as well. So there's so many intertwined things going on with the gut, right? You have the nerves, and you have, like you said, the immune system. And so many things, emotions. People say you get butterflies in your stomach. There's reasons for that. Our mind body is really our mind gut. And so I think it's really focused in on looking at the whole person. That's, as a family medicine physician, that is really my specialty, in the sense of not just looking at one particular area, but many times I hone in on the gut for sure. That's the beginning. Let's put what's in your mouth. How does that respond? And then looking at a variety of different things, because I, for example, work a lot with diabetics. This is one of my favorite things, is insulin resistance. We are talking a lot about what's going in their mouth, obviously. But we also talk a lot about mental health, right? The stress component, sleep, movement, all of those things will integrate back into gut health as well. So we can approach it in multiple ways, what's going in, but what are the other inputs that we're doing that also affect gut health? Because we are an integrated being. We are not just the mind or the brain, an eyeball, a hand. It reminds me of a story when my daughter was little. She did something. I can't even remember now what it was. She goes, but Mom, it wasn't me. It was my hand. And I was like, oh my heavens. So she's already doing this whole, she's going to be 30 in a few weeks now, but she's gotten over that. But I just thought it was really entertaining to see this child. She's already understanding that whole like reductionist paradigm that just really get us in trouble with regular science, right? We've just become so separated. And also, like we were speaking before we went live on the integrated team approach, so many of us, we go see the cardiologist, we go see the endocrinologist, we go see the rheumatologist, but we never speak. And so the poor primary care doctor, they have 15 minutes to make sure they have all the meds correct, and then give you refills or one other medication to deal with the side effect of the other medication. So nobody has time to look at you as a whole person. And that's the beauty of what we do. We have time, and I would say, venture to say, the expertise that a lot of people don't have, or the luxury to have. So I feel blessed in that sense.
I love that.
So beautifully said.
I think that's an excellent segue, because it is like, what is that process, right? Like, so if someone is, because we see this a lot, I've had constipation since I can remember, since I was little, since I was 7, and now I'm 27 or 37 or 47, and I still have constipation, but now I have eczema, now I have high cholesterol, now I have a headache, and I just go to my primary doctor and they keep running the same labs, if I even get them run every year. And I don't know what to do. So what is that process with you, like Dr. Marba? So we can start there, and then I know. What do you like, Lori or
Lori's
Dr. Marba?
fine. Lori is fine.
I know. I feel like I know you, but I want to be like,
we know
Dr.
you very
Marba,
well. We're friends.
I know.
It's all
We're
good.
friends.
Regardless.
Yes. Beautiful. So yeah, but what is that process, and where does someone start?
For me, whenever I see someone for the first time, they fill out an intake form, and I'm asking a variety of lifestyle questions. What is their habits? What is their values? Because I really also want to speak the language of that person. So we really get to, one, understanding where they are in their stress levels, what they have been engaging in as far as lifestyle habits. Are they smoking alcohol? Are they eating animal products, processed foods? Are they drinking sugary drinks? So I understand where is even the tip of the iceberg, that, it's an easy win, because if we could start with the easy wins first, maybe it's giving up one soda a day, or incorporating, one healthy plant-based meal a day, and just doing that slowly. That's the beginning. One is understanding on a personal level where our relationship will begin, because building that trust is really important to us to advance. Then as we go along, there actually might be, labs. I have particular labs I like to check on people who are consuming a plant-based diet, but there might be more specific ones. If someone is coming in on a regular standard American diet, they're dealing with diabetes, cardiovascular disease, all sorts of, you name it. There's a host of things that people throw at me, because a lot of times they'll come seeking out alternative care, although I don't like to think of myself as alternative care. I'd rather consider myself the way family medicine should be care, but that is what it is. So that's kind of how my approach is looking at the standard labs for my plant-based eaters, B12, homocysteine, methylenic acid, lipid panel, A1C, all those things, but also honing in on maybe some more standardized. You can still get at Quest or LabCorp, but I really like to look and see, where's the inflammation occurring, and just try to do the biggest, broadest, sweeping things first and see what's left over. And as we hone in, now, if they have a very specific gut issue, it'll depend, like, what are those symptoms? What have they had worked up? Well, let's look at the back risk. I don't want to go and repeat things. I don't want people to be frustrated because, like, I'm getting more labs or I'm getting more tests. Let's talk about it. Let's talk about it in the broad sense of what all these pieces you've already done and what do they could possibly mean, and really dial down a differential, like a diagnostic differential. And what that means is we're having a list of possible causes. And then when we look at those possible causes, that'll kind of lean us in the direction, okay, where do we even start? Do we need to do more diagnostic things? Or do we okay, we have a pretty good idea what might be going on here, and maybe we can start with some general approaches on improving your gut health or improving something else that might have impact on your gut. But so many times what you're seeing in illness is a reflection of the gut and what's going on. So like you said, like, skin is such an important piece. It's really interesting. I had one patient years ago who was 8 years old, and her mom called in. I was just seeing, it was more telemedicine, and it wasn't even like a plant-based telemedicine. It was just a general telemedicine. It was before I even launched plant-based telehealth. And she's like, she's had eczema since she was 3 months old. It's getting worse. She's been on oral steroids, every conceivable topical medication. It's spread. She's embarrassed to go to school. She's in pain. It was like really rough texture skin, like literally from her belly down. And she was like, she won't wear shorts. It was terrible. So we sat down and we just started talking about, what are we eating? I said, why don't we just start by removing dairy products? And because remember, part of gut health is removing what's causing an issue and then going into the repair, right? So there's kind of a removing the cause, restore and repair. And just by doing that, within 3 weeks, and mind you, she was 8 years old, completely cleared the eczema. She lost 5 pounds just from the inflammation alone. And it was really funny because before she left that first time, when I was talking to her and her mom, I was like, remember, you're not a baby cow. You are a human. And she came back in 3 weeks. She goes, Dr. Marbus, I've been telling all my friends that I'm not a baby cow. And I feel great, and she came back a year later and is still doing fantastic. So those are the things, those very simple fixes. We just got to take a very logical approach and don't get emotionally attached to their food choices, but understand our food choices really will dictate our health. We should be more emotionally attached to how we feel every day versus what we're putting in our mouth for a very short period of time.
That is so important, I think, for people to keep in mind, but so difficult to do sometimes because there's such a gap between what we want to do and what we are doing. And in between that gap are the communication signals our body is sending to us in these different symptoms that we're expressing and these different symptoms that we're feeling. And so we are talking about it and saying like, yeah, just make all these changes. But, there is so much culture, there is so much emotion that we unfortunately have learned to attach to our food. And we perceive things to take too much time or less time, but it can make such an impact. So that story that you shared of just removing one single category of food, just foods in the dairy category, cleared up 8 years of eczema for this little girl and likely prevented so many more conditions down the line, because if it's causing that much inflammation to, really create eczema in her, what else down the line would that have led to? So important for us to just, like you said, stop and listen to what our body's trying to tell us and why.
And that's an area you're used to. So as a dietitian in this, what can you add to that? Or what's kind of the process with your patients that you're going through?
Yeah. So just kind of hearing what they're saying, I just last night saw a patient and, he came to me and he was like, yeah, my wife wanted me to see you because her friend sees you and I'm okay. I've just been removing gluten, dairy, tomatoes don't make me feel well either. And neither do strawberries and and he went on to name about 20 different types of food. I can't have carbonated drinks either. And this I can't have. And I was like, So,
it's fine.
but he's like, yeah, he's
But it's
trying to tell me,
fine.
I'm fine. I'm just here for my wife.
Yeah.
So
Oh my
I'm trying
goodness.
to really, one, explain to him, it's not fine if you're feeling the need to cut out all these whole plant foods. You're really just
Right.
evading symptoms. You're not curing yourself, because even with that whole laundry list of things that you're not eating, you still don't feel amazing. You're still sometimes bloated. You're still sometimes having irregular bowel movements and cramping. So there's definitely something there. And then he also shared with me he's been taking an antimicrobial supplement for years. And so even with that, he's still not feeling his absolute best. So it was really just assessing, okay, let me hear what you're telling me. It sounds to me like a lot of the foods you removed are more fermentable, high FODMAP. Why are you reacting to these more fermentable carbohydrates? There must be some type of imbalance in your bacteria or your microbes living in your gut. Something might be off with your motility or the barrier of your gut to help you break down some of these carbohydrates and properly digest them. And then a lot of the foods that he described to me were high in something called histamine. So as he continued to say things, it kind of became a joke during the visit. He was like, let me guess, mushrooms are high histamine too. And I was like, yes. So, even if somebody does identify X food causes X symptom for me, we want to understand why, and really understanding more of the personality and the desires and the preferred foods of certain bacteria and other microbes in the gut can really give you those answers. So that way we know how to work with the gut and not just restrict more and more and more whole plant foods, especially because we know the benefits of adding them to the diet. So living in this perpetual state of an elimination diet is not a means to an end. It's kind of just running from the symptoms, what James and I like to refer to as gut debt. What we tell our patients is it's like you got in really deep debt, and instead of taking it head on and kind of assessing what it is, working with a financial planner to get out of it, you're kind of just like, it's okay. I'll just change my email and my phone number and my address, and I'm not in debt anymore, and I'm fine.
Just run from the debt collectors for the rest of your life. That's it. That's the solution, right?
But we know it comes back. One day it will show up again. You will need to buy a car. You will want to buy a house. You will have something that you want to open up a credit card for. So if that's what you're living in, it's not true healing. And I'm sure you've experienced something very similar as well with your clients.
Yeah, no, this is health karma, right?
Yeah.
So it really is. And just sticking our head in the sand, so to speak, is not going to make us well. I think a big piece that I see is one, we live in this world where people want instant gratification. So if I just remove this one food, that'll be the answer. Or this one piece, they don't want to take the time to understand we're complicated beings, and that we do need to take a holistic approach and speak to someone who has the time to sit down and look at, what are your symptoms? When did it start? Kind of being a detective, just like you were, right? It's like, okay, let's put these pieces together, all the puzzle pieces. Where can we start? That, something that is easy to start implementing. But I think that's a big piece of it. And we have normalized not feeling well, right? So when someone does feel well, they're like, wait, you're over 60 and you don't take any medications, right? You're doing this, and what? Why should it be the abnormal to see someone living a full and rich life in their 70s, 80s, and even to their 90s? Why should it be normal that we're seeing people in their 30s, 40s, and 50s having heart attacks, morbidly obese, struggling to just wake up each day and slog through a day? That is not the life we were meant to live on this earth. And people really struggle. Sometimes that will actually cause some people to become angry because, like, what? You're telling me it's not right? I'm like, I'm not judging you. I'm just stating a fact. And but it's something that can change should you choose to embrace that. So it's kind of like, he had to be nudged, but he showed up. And he listened, I hope, and we'll start engaging in whatever you're advising. So, you have to deal with a lot of this because actually most of my visits are dealing with the mental habit formation. I mean, honestly, the investigative, I feel like the medical piece isn't such a difficult task. It's literally helping people understand their behavior, how to implement change, embrace change, stop suffering. You're choosing to suffer by inaction. And, crafting that message in a way that they'll receive it and respond in a positive manner. So anyway, yeah, that's most of my discussions with people.
I love it. And then to
great.
reiterate integrative care, right? And integrate, you'll hear us probably say this even more throughout the video, but integrative is just what seems disconnected is actually connected, right? That's the idea of integrative care. And this is it. It's going like, oh, these foods are bothering you. And that's why as a dietitian or someone knowledgeable in those foods, you realize, oh, these foods have a virome and they have bacteria and they have histamines and some have lectins, all these other components of the food that the general population isn't aware of because they're not dietitians or doctors with this knowledge, or they haven't, spent hours and hours looking at the research and studying this. And so when you add that context, it can open up those gates in the mind. You start to kind of break down the walls of like, oh, you mean I don't just run from the food and I don't just try to have this quick fix mindset. Like, no, oh, I get the context now. And that really opens up gates. And it's so important to do that, right? It's like that old saying, you don't know what you don't know. And you're trying to fix a problem with what you don't know, right? That's kind of insane. And it's really just opening up those gates. So I think this goes well with some questions we have. And again, if you're watching this live, you can post your questions down below. So we have some questions that I think works well. We had a question come in. How about indigestion? Family members insist it's genetic hiatal hernia with no cure, meaning grandpa had a hiatal hernia and indigestion, dad had a hiatal hernia and indigestion, you are going to have, and your kids and your grandkids, you know what I mean? It's just going to keep on going. So that's almost, I feel like, is a wall we put up where we're just going to go, yeah, I know everyone in my family has diabetes, so I'm going to have diabetes. Just accept it, live with it. There's nothing you can do about it. We're just building this wall throughout our lives. And then I think we're here just going like breaking down the wall going, no, that's not true. So how would you guys start with that statement?
I think one, it's understanding that when someone comes with whatever the disease, it could be heartburn, GERD, whatever, diabetes, heart disease, breast cancer, it doesn't matter. Now, it doesn't mean that you don't have genetic propensity to have something happen, right? So we've all heard it, the genetics will load the gun, lifestyle will pull the trigger many, many times, 98% of the time. But when we think about it, what is this person doing? It's a self-fulfilling prophecy is what we're doing. And people don't truly appreciate by them already accepting a story, they're going to probably do the activities that lead to the fulfillment of that story. It's kind of like, I'm going to go shopping for a new car. I'm going to buy a Volkswagen. Well, suddenly, Mission Viejo, California, everybody's driving a Volkswagen because my brain has been associated with looking for that. So if I understand that everybody in my family has heartburn or has diabetes, I'm going to be looking for that in myself. So one, you probably won't start engaging in activities or health activities that will prevent it because you don't understand that you can. So you just continue down with the habits, the lifestyle habits that you were taught, how you were eating and everything else. You go to the doctors who tell you, yes, you have genetics. Here's another pill. Oh, there's nothing you can do. Oh, you'll have it forever. Instead of looking at alternatives and understanding, we didn't develop this chronic disease that we're seeing, this robust chronic disease narrative in this country overnight. This was probably in the last 50 years. Our genetics hasn't changed. We weren't this sick 100 and 200 years ago. We are very sick now. And so that's where I start. Number one is making it very clear to them. And they get this in their head. Number one message, because I don't want them to quit and use that as an excuse and say, quit in the sense of trying things that will make them better, looking at their picture as I can do so much to heal this body and mind. That's, like I said, where most of my work starts. Now, when it comes to the GERD piece, I'll turn that over to you. But that's where I start, is always, okay, let's listen to what you're saying.
Such an important reflection. And from there, it makes me ask questions like, were your father, grandfather, whoever, were they constipated? Because 9 times out of 10, my GERD patients, my patients with LPR, they are constipated. There is such a strong communication signal between the stomach and the colon. It's called the gastrocolic reflex. And when the colon is backed up and full, it's going to also back up the stomach. It's going to say, hey, man, I'm full. Slow down whatever you have going in there, decrease their appetite because I can't even handle what I already have going on. So please don't give me a bigger workload to work with. So that's always my first question. Were they constipated? Why were they constipated? And that's where we go into, what did their diet look like? What does your diet look like? How's your fiber intake? How's your movement? How is your gut bacteria? What was your antibiotic use like? Were you an antibiotic family? I grew up in one, right? And we see that where, okay, for every little sneeze and sniffle, are you running to go get an antibiotic? That's likely wiping out a lot of your good bugs and a lot of your helpers that are helping with motility. After you took antibiotics, were you historically then eating probiotic rich foods? Were you having prebiotic fiber to really reseed and restart your gut? Did you ever take probiotics if they were appropriate for you? So really asking those questions of, how did that hiatal hernia get there? And how is everybody developing this reflux and this LPR? Because absolutely, it is more of a lifestyle. Certainly, there's that very small percentage of genetic factor to it, but most of it certainly is lifestyle. So really reflecting upon those things, because almost always when my patients start having regular, complete, and satisfying bowel movements, they come back and they're like, guess what? My reflux is gone. Or I'll ask them about it. Hey, how's your reflux? How many days a week are you having it now? Oh, I forgot about it because I actually haven't really been having it anymore. So it's asking those questions as well. What's going on below to give you these signs and symptoms and signals up top? And the last thing I'll ask about usually is that gut-brain connection. What's your stress level like? And how is your vagus nerve, which what I call the elevator that connects the gut to the brain is that nerve. How is that doing? Are you in a really tense and stressed state very frequently? Because that could also be slowing down your gut motility, and that can be affecting the flow of things. So we do know that absolutely can play into reflux, LPR, even the development of a hiatal hernia. So those are always things that I'm ruling out, I'm investigating, and I'm trying to support as a dietitian. So we're talking about squatty potties and eating fiber, and if necessary, adding a nice hydrating fiber powder or whatever else is needed to just really get them going and going well. Because it's not enough to just go every day. You need to make sure it's complete and it's satisfying.
So I really want to get this across that, it's just like, it's so crazy because we see this in so many areas. There's so many examples of this adaptation, right? Where if I move to Alaska, or I should say, or even China, right? If I move to China, I'm going to learn the language. I'm going to adapt to the culture. I'm still going to be me, but I'm going to take on adaptations that help me survive and live. Our body is very similar, right? We see this in the science, especially in the gut microbiome and the new research coming out. What we're eating, what we're putting in is going to help our bodies and our health and our overall physiology, right? Our organs and tissues, and membranes, and the list goes on, adapt. And we literally know what we're putting in our body. I think people either don't know or forget the food you literally eat has DNA. And that DNA can be transferred into our DNA through a very cool process, but I won't get into that. But the overall point is just like we can adapt in these macro, like outside clear examples. Our body is doing that at the tiniest level all day, every day, with every meal. That's really where our catchphrase came from, is heal with each meal. Because with each meal, you can drastically change things in your gut, in your whole body, day after day, week after week. And so your genetics do not define you, right? The fancier names are nutrigenomics or epigenetics. It's all these really cool areas of study and going like, whoa, you can alter your DNA, so to speak. You can alter your health just in the same way. If you move somewhere and you're going to alter the way you speak and how you live a little bit, your body can do that for the betterment of your health, your symptoms, your overall well-being. And it's really cool. So yeah, that is really cool. All right, let's keep going with some questions. Another one, I mean, what do you think, Delia?
We have 2 questions on different types of colitis, and I always
Yeah.
like talking about this because
Go for it.
I think there's so much misconception around different types of colitis, but one person's asking how to approach healing of microscopic colitis, and then someone else is asking about ulcerative colitis. And I always like to explain the difference between the two. Microscopic colitis is really from inflammation in the gut. Whereas ulcerative colitis not only involves the bugs that live in your gut, the bacteria and other microbes, your immune system has really put itself in the mix as well. And now it's more of an autoimmune condition. So microscopic colitis is one that I have seen reverse with just pure lifestyle, whereas ulcerative colitis, and now again, something that's involving the immune system, can often necessitate medication, especially to induce remission.
And just to say really quickly, colitis is just inflammation of your colon. Your colon is inflamed, right? And it's like inflammation's good, but this is like on fire a little too often. It's uncomfortable. You're getting symptoms. You're not feeling well.
Yes. So microscopic colitis is saying, oh, there's a little fire and maybe it got out of control. Maybe we threw a few too many logs on that bonfire and now things are starting to burn in the surroundings, which ends up being first the mucus barrier, the mucosal lining of the colon and of the gut. And then ultimately it can damage the tissue, the gut epithelia. And so there is some of that microscopic inflammation in the lining of the colon. But again, that is something that's a little bit more manageable where we're saying, oh, we're seeing it. So let's try to dampen this fire and reduce this fire so it's more well controlled and it doesn't continue to cause more and more damage. Once you get into ulcerative colitis, there's been a much more significant amount of damage. And we know ulcerative colitis is, again, autoimmune, and it's an umbrella term. And underneath that could be Crohn's, which can be involved in both the small intestine and the large intestine, or just ulcerative colitis itself. So both are under the umbrella of inflammatory bowel disease, rather, where just the bowels are inflamed. And we know there are risk factors for both, but both do involve the bugs that live in the gut. There's more and a higher percentage of that inflammatory bacteria and other microbes. And we now can name them. There are studies now that can name specific strains of bacteria and other microbes that are more abundant in the microbiome of both those with microscopic colitis and with ulcerative colitis. We see more of what's called sulfur-reducing bacteria, where they'll eat up sulfur and they will create a gas called hydrogen sulfide, which can be very irritating to nerves. And the gut is a very abundant bundle of nerves. We see a lot of yeast overgrowth also in those with microscopic colitis and ulcerative colitis. So now we're learning how to kind of play with the bugs, but we also see in both heavy antibiotic use. We see stress as being a large factor. And then the biggest factor tends to be inflammation coming from diet and lifestyle habits and factors. And we do see in studies that ulcerative colitis especially tends to be diagnosed in the 20s and 30s. I do tend to hear a lot of my patients tell me, yeah, after college, I was super stressed, eating like crap in the dorms, partying every night and binge drinking. And then I was diagnosed with ulcerative colitis. And now we're seeing that colon cancer is the fastest rising cancer in those 20 to 50. So keep that inflammation going and those cells start to mutate and turn into cancer. But there's so much that can be done and so much that I love suggesting. Lori, I'd love to hear whether you've worked with those with microscopic colitis or ulcerative colitis and what some of your favorite suggestions are.
I think really it's helping patients understand they oftentimes will come in the heat of a forest fire, so to speak, like you're describing. And it's really important that they get the forest fire under control because you don't try to plant trees in the middle of a forest fire. So that's why I appreciate and help people understand there is absolutely still a place for medication. And sometimes, at least what I've seen is that people have almost feel shame about being on medication or taking medications appropriately, right? So
Mm.
that is one thing that I would say is number one. And number two, it's really removing the offending agents to get started, right? So we don't want to keep feeding the forest fire. So this is where we talk about removing the dairy, the animal products, and then you have to do a very gentle integration of those plant foods, right? Because they can't just go right on to eating some raw salads, and we're just going to cause a lot of GI upset and continue there. So really, when it comes to my personal experience and what I've done, if someone is very, very ill, I'll make sure that they have a specialist like gastroenterologist, RD like yourself, to really help manage. Let's get this tamped down. And then when they've seen someone like yourself who can give them more prescribed dietary pattern, because it's going to get very nuanced. And typically my appointments are much more on the higher level. We get them, again, I deal mostly with, like, say, diabetes. You might have gastroparesis, those type of things. Definitely have GI issues. But when it comes to ulcerative colitis and the microscopic colitis, I typically, I may actually diagnose it because it has not been diagnosed. That's more common than not. But then actually get the specialists involved, because when the specialists, sometimes if they're not understanding or integrative like ourselves, they may just say you have to be on medications forever. But I'm like, okay, come back to me when the fire is simmered, and then we can start introducing more of these, foods that can heal, how to appropriately cook them, what are some natural herbal remedies that can also help aid in that, the appropriate probiotic use, those type of things. So that's how more of my approach is, and making sure they have the care that they need, because as a primary care physician, that's really, really important, that I can send them to someone that they can trust. But sometimes they're limited by, geographical location. I lived in Western Colorado for many years, and you had to travel over the Rocky Mountains to see a specialist. So we did what we could. We got people on the phone and said, what would you suggest? Or, back then we didn't do this as much telemedicine stuff. And so that's typically my approach, and really enlisting the aid of, I would say, micro specialists like yourself.
Oh, I love it. And that's where it's so important, yes, to have that full team, because your primary care doctor is your anchor. They hopefully have been with you. They understand your story, how you got there, and they're really going to help navigate the team. They're like the general contractor, right? And they're going to kind of navigate each person who's working on that job. And so it's so important. I sometimes have patients ask me, like, oh, why do I need a primary care doctor or a gastroenterologist if I have you? And I'm like, because I don't do the things that they do. I can't give you a colonoscopy and prescribe meds and diagnose you with anything. I'm just here to talk about nutrition and supplements when necessary. So it's so important to have the appropriate players in the game, because we're all going to bring different information and a different specialty. But yeah, with colitis in general, we're going to talk depending on what stage that person has, because we know even with ulcerative colitis, there's different stages of it, right? Do you constantly pass blood when you're having a bowel movement? Is there mucus in there? Do you have pain? Do you have urgency? What stage of your colitis are you in? Are you near remission? Are you just completely out of control? And we'll assess what are your symptoms telling us? And then what are your labs telling us? What are your inflammatory markers telling us? Your calprotectin and lactoferrin. What does your colonoscopy look like? Do you have ulcers? Do you have damage in the villus structure? What are all those things telling us? Because then we're going to alter the diet even more as necessary, where maybe not just picking certain foods, but also we're really breaking down the fiber in those foods. Still getting the benefit of the fiber, but the fiber is not causing irritation as it's moving through. It's so important to have that complete care team, because I often have patients ask me, well, what do I do? And they're like, I don't want to get a colonoscopy. And I'll be honest and tell them, I can't tell you what to do, because I don't know where we're starting from. Important for us to have that complete picture, so we really understand what appropriate medical nutrition therapy you need, or else we're kind of just shooting in the dark and we run the risk of maybe doing more damage. So yeah, often there are conversations around, hey, these are the medications that are options. Talk to your care team about them. And in my experience, and this is what the data shows, this type of medication is more likely to be lifelong. This type of medication can help induce remission, and then we'll use lifestyle to hopefully keep you in remission. But, we see the whole spectrum and the whole gamut. And of course, respect every person with whatever choices they want to make, but hopefully provide them with informed consent. So they really just understand the risks of these different modalities and what using them looks like and what refusing them looks like. So I just think that that's so important. So each person cannot have that regret of saying, why didn't you tell me that there was this medication? Or why didn't you tell me there were side effects of that antibiotic I took? Or why didn't you tell me food could have helped? So it's so important to just bring that area of their expertise.
What you both are saying, really, the theme is that information, right? Because you can't have consent without information, really connecting the dots. I mean, so powerful. I mean, it's great. And that's where, Laura, you come in to really diagnose, because you see the light bulb and kind of like the eyes open up a little bit and go, wait, what? And that's the power of these diagnoses. I know we talk about integrative, where everything's all connected, but if patient comes to us and go, everything's wrong with you, and we're not giving them specifics, it's like, well, where do I start? So that's where it's a balance, right? We're not saying throw away all medications, throw away all specifics. No, we're going to use these specifics in the right way. And it's powerful because you go, whoa, I have ulcerative colitis. Whoa, what is that? Let me learn more about that. Even before that, though, understanding that the constipation or the trauma as a child will increase your risk of IBS as a young adult, even as a child. And then the idea of having IBS increases your risk of IBD by 1,500%, according to some studies. So that gets into the ulcerative colitis. And along the way, I mean, there's even more stats on diabetes, increasing risk of heart disease, and so many cancer. And so it's understanding, if you have kids, if you have grandkids, if you're young yourself, if you're in your early 20s, or even if you're older, great. Now is the day where you can make a drastic impact, where you can start making changes. And that can change your nieces, nephews, grandkids. It can make a huge impact in your family to prevent, right? This information can prevent, it can inform, even if something's going on, you have symptoms, empower you to then make those changes. But really, I mean, that's what we're all talking about here. That's why we're even making this video, is like to empower you with this information, to really help guide you, whether you can prevent. You most likely can definitely reverse and eliminate symptoms, and you can have a better outcome of your life. Like, who doesn't want that, right? It's a beautiful thing. So very cool. I know we have,
and this question was really specific, and I always want to remind people this is not medical advice, but this person, with James making those connections between IBS and IBD, this person asks, how do I heal my 18-year-old with ulcerative colitis, not responding to oral meds? They have elevated liver enzymes. They ruled out any liver disease. They're seeing a liver specialist, but and they received an iron infusion, but the doctor's saying diet will not heal the gut. It may just improve the symptoms, but it won't heal the gut. Now we're seeing in studies, again, there's that connection. Does this person have IBS? There have been several new studies that have come out to show that if somebody has intestinal methanogenic overgrowth, IMO, which is a type of SIBO technically, that can increase liver enzymes, and that can cause liver inflammation as well. Certain gut bacteria will produce gases that can irritate the liver. And if that person has had IBS for years, that can increase risk for IBD. And, with IMO or SIBO, it does often include treatment in addition to diet. It's very seldom that diet alone will heal SIBO or heal IMO or heal ulcerative colitis. But it's such an important piece. So even if it won't be the end all be all, because I do sometimes also have people come to me and they're like, it has to be nutrition and I don't want to do anything else but nutrition. So really understanding it can be both without kind of overlooking that it has to be both, right? It can't just be meds. It can't just be diet. Sometimes it has to be both. Sometimes it doesn't. Goal is definitely, like you were talking about, Lori, to be that, mower a more wise person who has not taken medication or has gotten off of their medications. But it's nice. They're kind of like a life jacket when you really need it, when you're drowning and you need more information. So I would encourage that person to really continue to ask, well, why? Why? And if your care team can't answer, then keep adding members to your care team or get a third, fourth, and fifth opinion if you need to. I always remind my patients, we work for them. They don't work for us.
Right, exactly.
I have to hold on to that life jacket picture too, because like, yeah, you're drowning and the medication is your life jacket, but ideally it's to pull you back on the boat. It's not just to leave you out there. Like, right, you have 5 life jackets. We're just gonna tug you along the boat. Good luck.
Right.
Okay, hopefully sharks don't bite your feet and your legs. It's like, no, and then we ideally pull them back on the boat and then not keep the 5 life jackets on, right? While you're on the boat, let's take off the life jackets, right? That's medication, right?
Get them a new set of dry clothes and keep
Yeah.
them warm and feed them a nice meal. Yes,
There
you
you
can
go.
go on and on and
Go
on with
on
that.
and then have a nice time on the boat, right? You're
And
thriving.
then land on the tropical island and stay put for a while.
Exactly. So yes, it could keep going. So that's a beautiful analogy of medication where you don't have to keep it on, just like you wouldn't keep on that life vest once you're on the boat. So yeah, but yeah, I just wanted to say that. But very cool stuff. We're seeing. Where do you want to go? We have some questions here like that. Okay. Any advice on how to normalize these gut health conversations when family may not be taking it as seriously, so that we can advocate for our own individualized health? Just give up on family. Family will never. No, I'm just kidding. No, family can be difficult for sure.
And it's hard to send a changed person in an unchanged environment. So this is a really good question. I'd love to hear your thoughts on this, Lori.
Yeah, so I think this is with anything, right? So I think this comes out a lot when people just even embrace a plant-based diet, not even necessarily to engage in trying to reverse a particular disease process. Just eating differently gets people riled up, right? These emotional attachments. And I've had an experience once that I was eating, we'd gone out with some people that I didn't know very well. And I don't wear that out of the fact that I'm a doctor. It comes up sometimes in conversations. People ask what you do. And so it's a known fact, but I don't like, I'm a doctor, you need to do this. Now, never mind. So anyway, so we're going out to eat, right? And this person, I'm doing my plant-based ordering thing like I normally do. And I get my food. They're like, wow, that looks really interesting. Why are you eating this? I was like, oh, I eat a plant-based diet. And, just said, yeah, it's really good. And I've done it for a while. And they're like, look at me and go, what? So you're saying what I'm eating isn't healthy? I don't know this person. They just basically said that I was insulting them by ordering something for myself. Wow. So I think this is kind of how we have to think about it. This has nothing to do with you. It has everything to do with your family or whomever it is, your neighbor, your sibling, your coworker. When they reject or cause resistance to whatever you're doing, understand that don't take it personally. It's just their ignorance and something that they will have to deal with. You can approach it in any way you want. I typically like to use humor. I try not to fuel the situation by try to say I'm right and you're wrong. That'll get you nowhere. But just saying, I respect what you're saying. I'm giving you space to express your thoughts and decisions. But I have to be aware that this is what my body needs and what I need to do. And I said, if all else fails, just say, my crazy doctor has me on this diet. What can I do? So I was like, so whatever you can do in that way, just don't feed into it, but don't get pulled into it thinking, start creating doubts in yourself that because you've chosen to be your own health advocate and someone else feels that was the wrong action. That is a negative, guys. Don't be pulled into that story. They just want to pull you down their stream of dysfunction further because it's something that they're used to. And if someone that they're close to is doing something different, it's scary, it's unfamiliar, and they don't want to be abandoned. They don't want to be told they're wrong. And, humans are complex, interesting creatures. And so we have to understand people come with their own situations, their own history, their trauma, their stories that they're telling themselves. But you can be the presence in that moment to just give them some space, accept this is the way it is, and say, I appreciate you, but I'm going to be doing my own thing. Thank you so much. And just leave it at that and be happy with that. And if they keep coming back, maybe
You're curious.
maybe you have to remove yourself from that situation and say, I have to put boundaries around here because I don't want to upset you, but I can't talk to you about this until you're in a state of being more open, that I need to be that, discussion about my health, and the way I'm choosing to eat is so wonderful for me, that I can't have you causing conflict in my own mind. And so I can't just discuss it with you. So anyway, there's lots of ways you can approach it, but that is typically what I see.
And I love it. I mean, I know from personal experience, I always was just turn it back on me. Like if someone was kind of making it, because they're kind of making it about them.
Yes.
Right. And it's like, well, wait a minute, this is what I ordered, not what you ordered. So I just kind of
force feeding you.
not to be
so
like,
funny.
yeah, not to be like too narcissistic, but it's I just put it back on me. Like, hey, I would just share my testimony. Like, I felt so great. This is what I'm doing. This is why. And it was for health reasons. Like I used to get sick a lot and have allergies and joint pain, and now I don't. That's it. That's just why I do this. I'm continuing to feel good. Like I don't drink caffeine, and I see people drinking 5 cups of coffee a day, and I feel wonderful. And what can they say to that, right? And I would say if you don't have a testimony yet, but you're exploring changing, your lifestyle and your diet, then just do that, right? Just focus on your actions being the words you need, and then see what happens. And in 6 months, 12 months and longer, then you go, wow, you know what? I'm not on that medication I was once on, or I'm not feeling this way I once felt. And now you have the testimony to kind of shift perspective a little bit and make it on, what they're asking about, which is your plate, your food, your why, your health. And then you can share that, right? And I feel like even if someone, because we've had some hostile family and friends, and what can they say? Once you say that, it's like, oh, what are they going to be like? Oh, how dare you get healthier? Like, oh, it's like that really kind of calms it down, and or just kind of makes them think, plants a seed. And then you're just like, yeah, cool. Great.
Yeah.
If you have any more questions, I'm here. It's like,
Yeah.
And I think one challenge can come up though if you're still living with these family members, but that still gives you that opportunity to be the change within the home. It's definitely harder when you're doing it alone, or when you're surrounded by everyone else who's doing something contrary to what you're doing. But it really gives them the opportunity to witness your transformation along with you, where they're maybe experiencing what they're experiencing and you're not experiencing those symptoms, or you're having great energy and you're having great stamina with your workouts, and maybe they want that thing. So I think it just enables them to have that closer look. It's definitely more work for you. But it is just remembering your Northern Star, why you're doing it, and what is going to help you continue doing that thing, because you started it for a reason. So you started it for you. Don't drop it for other people, because you're the one who's going to feel the symptoms of whatever comes as a result of those lifestyle choices.
Yep.
Wow. Well, I know we could keep going. I see more questions come in, but do you want to?
Yeah, we have
you wanna
just a
answer one
couple more quick
Okay.
questions. This is an interesting question. I know this has been kind of a taboo
Bad
topic.
cooking
Oils.
affect your gut.
Oils in general, right? We're having a lot of people talk about seed oils and whether we should eat oil or not. And I know there's a wide gamut of opinions when it comes to oil and fat in general. But I'd love to hear, Lori, your opinion on bad cooking oils. I will say maybe more inflammatory cooking oils than just your in general.
So, how do I just start this discussion? So this is how I approach oils in general in conversation is, so most of the time people are coming to me from 2 camps: very ill, chronic disease, or they're the worried well, and they want to make sure that they're doing okay, and that's okay. And sometimes my worried well are very fat phobic to a degree that it can actually be harmful. And so I think there's been a widespread how should I say this? Widespread wording in the plant-based community that you should only have low fat. You have to have low
Mhm.
fat. Low fat's the only way. But then people come to me fatigued, they're tired, and a lot of things can be occurring. I will say, even with my own experience, when I first went plant-based 12 years ago, I went to a very low fat restrictive diet like that, and I didn't feel well. And for me not to be like, let's go get something done, is weird. And so I was like, what is going on? And so, I added healthy fats back to my diet. It wasn't in the form of oil, but nuts and seeds, avocados, and I felt great again. So like, okay, that's an important piece. There's omega-3s that are involved with these nuts and seeds. There's wonderful things. Now, where I do provide caution is liquid fat, like cooking oils. They're very high calorie dense foods, right? So this is where most of my patients require weight loss. We're dealing with insulin resistance. We're dealing with a bunch of things that it's very easily absorbed, even if it's good, considered like olive oil, which is considered a healthy oil. It doesn't help me with my weight loss situation that I'm trying to help someone. But I'll say, instead of doing the liquid fat, let's go for, a handful of nuts and seeds, walnuts, pumpkin seeds, whatever you like, ground flax, hemp seeds, looking for getting added benefit, not just the fat component. Now, if they want a little bit of fat with, a dressing or something, let's how can we incorporate those whole foods, so you get the fiber and the micronutrients and everything else that comes along with it. Now, if I have someone who's young and healthy and they want to use oils, in particular for cooking or dressings, I think that's fine. That's absolutely fine. But we want to be very mindful about what type of oils we are using. And I'll let you take it from there. But I typically reserve, saying try to stay away from like coconut oil just because of the high saturated fats.
Mhm.
I'm dealing with patients typically with cardiac disease, like I said, insulin resistance. So these are just things that I don't want them adding back into their diet. But from the gut point, I'd love to hear what you say on that.
I'll comment really. I'll let you take it over, but the data's there, right? And I think it's just not in plain sight of going like, yeah, fat in general and too much hyper refined fat. But really, I like to talk first and foremost about the gallbladder, right? So we're seeing the gallbladder of 2.4 million just Americans a year being removed, and this is directly related to the amount of hyper refined fats you're eating, right? So it could be in a tortilla chip that's deep fried. It could be in that steak from a sick cow. It could be all that the cheese or it could be refined oil that you're cooking with.
Or in a dessert.
Or in a dessert that's full of just refined fats and oils, and even sugar. If you're getting excess refined sugar, turns into fat, right? Triglycerides in the liver. So adding this context, this isn't to say go fat free like the message was in the 80s and 90s and just take out all the fat, just never eat fat. No, it's the type of fat, and it will have a direct impact on the gut. I'll let you kind of take it from there.
And that's where I think that word is key, just hyper refined as well. And, liquid oils tend to be hyper refined. Again, not saying that we're always telling people don't eat oil at all. If somebody, it fits well within their, caloric needs of the day and they feel well having high omega-3 oils like olive oil or avocado oil in moderation, then there's no data that shows that that's detrimental to their health. There's actually some data to show that that can be a little bit conducive to absorbing fat soluble vitamins and decreasing inflammation and things like that. But I think when it comes to these oils, right, when we're talking about high omega-6 oils like soybean oil, sunflower oil, palm kernel oil, where are you even finding that? Usually it's in a food anyways.
Processed
So
foods, yep.
yes. So I really don't think that that's the focus. It's not necessarily the oil. It's who's the medium to carry the oil into your body anyways. If that can boost your overall gut health or your
Right.
overall health.
Right.
So, rather than focusing on these tiny little minutia, not that nutrition isn't nuanced, it's saying, what is my overall dietary pattern looking like? Am I intaking whole food omega-3s? Am I getting in my nuts, my seeds, my avocados? Can, a little bit of avocado or olive oil fit into that? And then, yes, am I coming in with some type of risk or disease? So do I need to be exceptionally more careful? And even for the gut, avoid saturated fats, because studies do show that they also can induce more of that intestinal hyperpermeability, or leaky gut is something that, we commonly will call it. But yeah, asking yourself, what whole food is bringing you in palm kernel oil or soybean oil?
And
Really
you
just
don't snack
taking
on
that step back.
palm kernels and cotton seeds? You don't snack on cotton seeds? Make
Oh,
cottonseed oil?
goodness.
So
Yeah,
I
think
know, I
of
think
the food the oil's coming from, like
Yeah.
cottonseed oil. Who eats cotton seeds? Palm kernel oil. Who eats palm kernels? Like where are these oils coming from? They're really just
Right.
waste byproducts from the ag industry that they're just putting into waste products, which are just these hyper processed foods. You're going to find these in just really the lowest quality cakes or little like shelf stable cookies and muffins and things.
This is
It's
not
like,
food.
it's not
It's
food. It's
Franken
just,
substances that are edible.
yes.
yeah.
And that's where I think whether replace the word fat or oil with a hyper amount of hyper refined proteins, that's also not great for your body, right?
Right.
You're not wanting to consume large amounts of soy protein isolate, or
Right.
whey protein, or whatever it is. Excessive protein is not great for your body, your kidney, and other organs, or neither are hyper refined carbohydrates. So really, I think we can all hold hands and agree that it just comes down to these hyper refined, ultra processed foods. So if we really just keep that in mind, keep them extremely minimal in our diet, I think the world would be a healthier place for it, rather than focusing on these very, very tiny things.
Yeah.
And we have several questions of people like, what's the worst food? And I think the foods that are hyper ultra processed are not
Yes.
conducive to your best health. So
In any shape or form.
yes.
Yeah, I want to make it clear, like broccoli, grains, like whether it's quinoa or whether it's like wheat or whether it's I don't know, millet, or nuts, Brazil nuts, peanuts. All, like I would say there's really no whole plant food. I'm like, okay, peanuts are the worst.
No. Yeah,
When we're talking
exactly.
about what foods are not great for your gut, they're really just the man-made, Franken GMO, like hyper refined foods that really you can't find them growing anywhere, right? So that's where I want to just clarify that, because plant foods are getting a bad rap. There's people out there telling you don't eat fruit and don't eat grains and don't eat beans. Like, wow, that's a red flag, right? That goes back. And I know we've been going for a while, but if you go earlier on, where we're saying you're running from your symptoms, right? You're running from the gut debt. That's what they're doing, right? They're going, don't eat grains because it's going to make you feel bad. Well, why are you feeling bad? What's at the root of that? You're running from it. You're just running from it.
Yeah.
Exactly.
And you're not going to reach that place of healing and vitality. So if your goal is to heal your gut, to reduce your insulin resistance, improve your glucose, improve your cholesterol, improve your body composition all around, the answer is plants. So adding more plants to your diet. If you find that you have symptoms when adding those plants, that's when you need to work with someone, because the answer is not just cutting out those plants. So my end all be all the time is try to eat at least those 30 different types of plants per week. That is very conducive to great gut health. And try to get in your probiotic foods. I always recommend that, especially for those on a plant-based diet, because usually they're not getting in enough probiotic foods. So trying to get in those 4 to 6 servings of probiotic, not just fermented foods, but probiotic rich foods, is also great for the gut. So if you're doing those 2 things, you should be doing pretty well.
Feel free, anyone to jump in. I'm going to also say okra, specifically for this question I saw come in. Okra, chia, gooey foods, oatmeal.
Aloe.
Yeah, aloe, these gooey foods. When we're talking about lining, and it's really not just your gut lining. If you think about it, we have a mucosal lining starting from our mouth and our nose all the way down to the very end, right? And so you're going to help that lining. And
Include
it's
those in your
beautiful.
30 plants per week.
Yeah.
All right.
Yeah.
We got to touch on quite a bit. Any parting words of wisdom that you have for people, or if they want to work with you, Dr. Marbaz, we'd love to hear what you have to say.
Thanks. Yeah. Wow, this was amazing. I think it all comes back to don't be afraid to ask for help, right? So if you're stuck in a situation where you're not happy with the care that you're getting, it's okay to ask for additional opinions. And if the physician or whomever has a problem with them getting a second or third opinion, these are not the people that you want to be working with, because they don't have your best interest in mind. Like you said, we work for them, they don't work for us. And in that segue, if they do want to work with me, I'm at drmarvis.com, and have all sorts of ways to engage with us, including the Healing Kitchen, which is a partnership with myself and Brittany Giroudi. And we actually meet live every Wednesday. She provides 2 delicious plant-based recipes. We watch her cook it and salivate. And then I answer all the medical questions. And then we have every month expert workshop, which we get you guys scheduled on. And then I provide a workshop every month. So like this month is literally Plant-Based 101. I go over 12 years of seeing thousands of plant-based patients, what to do from A to Z, answer all the questions that they have. Literally, anyway, I've done osteoporosis, insulin resistance, psychology of weight loss, a bunch of stuff. A lot of the questions and things that I get, those come with an ebook typically at every workshop, and those are free to all the Healing Kitchen members as well. So.
And your community is active. I love seeing all their engagement. So,
and down below, links down below in the comments if you're watching this later on. So we'll have links down below. And then again, if you guys want to find us, we're marriedtohealth.com. And Dahlia is our resident gut health expert, dietitian, all the cool things. But
I'm joined by 5 other amazing plant-based dietitians who specialize in oncology, pediatrics, metabolic disease, emotional release if you're struggling with your relationship with food, eating disorders and disordered eating. So I think between the 3 of us and our teams, we really got your back. Teach you how to cook, teach you why you should cook that way, and what you should be doing.
Yeah, no, it sounds pretty comprehensive care.
Yes. Well, thank you so much.
Yes.
Thank you so much, Lori. It was awesome to connect with you and talk to you, have this conversation. Guys, if you like this, give us a like down below, comment down below, and we hope to see you back again for another Good Gut Live and also Dietitian Talk Live. And definitely connect with Lori down below. Links will be in the comment section and the description section. All right, everybody. Well, have a great day. And as always, heal with each meal. All right. Bye, everybody.